The intent of the session that was presented was to address some of the issues and barriers that can interfere with promoting a healthy work environment for nurses in oncology practices. I think we are more sensitive to some of the emotional domains in our practice that our patients and families face, but we fail to address how that may affect us as nurses as we not walk them through their cancer experience, but many times we walk with them through their cancer experience. Promoting a healthy work environment, particularly in healthcare settings and nursing, is evolving in the literature and in our research base is very critical in retaining seasoned, experienced nurses. And so we need to be looking at administrative and leadership factors that help promote a healthy work environment, but also looking at personal factors and our awareness of them so that we can put together interventions that would increase nurses' retention and longevity in their particular fields. There are a variety of interventions that look at how we deal with nurse grief and bereavement for ourselves and mourning, as well as looking at ways that we can reach out to families in a way to augment some of our feelings of mourning and bereavement. There is a spiritual side that we talk about in terms of working with pastoral care and other members of the team, that we can look at some unique interventions such as blessing of the nurses' hands when they work with chaplaincy and pastoral care. All in all, it is an area that has not received very much attention, but I think we're beginning to see that this is something that requires a lot more intervention, and particularly as we look at the costliness of turnover of very seasoned nurses. One of the approaches that we've talked about in our session was that nurses should do an inventory of what is available not only in their immediate work setting but in their community. Many times there may be counselors, there may be volunteer programs, there may be employee assistance personnel in the area where they work. But I think many times there are resources out there, there are people and programs that we aren't even aware of, and many times these people are very interested in working with us in our individual settings. I know, for example, a very busy private practice where nurses went to the physicians they worked with and said, you know, we need to have someone to talk to about when we have patients die or we have some issues with some, quote, difficult families. And these physicians were willing to bring in a psychologist once a month to have lunch with all of the staff, nurses, physicians, the nursing assistants, to help them jointly discuss about some of the issues they were having. The name of the book, recently published, is Self-Healing Through Reflection, a workbook for nurses. And it is not just for oncology nurses, it's for all nurses. And there are a series of exercises and case studies so that nurses have some resources available to them to look at some issues such as compassion fatigue, nurse grief, depression, secondary traumatic stress. They are short chapters specifically written in that forum so that nurses can use a very practical kind of a workbook for them to use in their individual settings. I've been in oncology nursing almost 40 years, and I think many of these emotional issues come not only from my professional practice, but also being on the opposite side of the bed in terms of being a recipient of nursing care. And so I think that lends additional credibility to knowing that some of these emotional demands on us need to be addressed in a more forthright way.